Hi, my name is Dr Alikhani. I am Dean and Professor at CTOR Academy, and I'd like to welcome you to another session of CTOR's channel. Today, as part of the biology of orthodontics and craniofacial orthopedics, we continue the discussion that we started 2 sessions ago on effect of static forces on cortical bone. Now that we went through the experiments, we need to emphasize what is the clinical application of all these experiments. Why is so important? In the last 2 sessions, we demonstrated that in response to application of static forces to the alveolar bone, there is a new biological target that we did not recognize so far. Most of our studies has been focused on the effect of the suture, condyle, and PDL as the target of our orthodontics and craniofacial treatment. And now, for the first time, we are introducing periosteum and endosteum as 2 other important biological targets that have a similar significant effect on treatment as suture, PDL, and condyle. The second important factor of these studies was the fact that in response to application of static forces by expander, 2 phases appears on cortical bone. One is catabolic, when the cortical bone goes through the resorption, and that phase follows with anabolic, when the cortical bone goes through bone formation. And that phenomenon we called it cortical drift. This is clinically very important. First, it tells us that during the anabolic stage, we should not interfere with the process by referring our patients for periodontal surgeries or any surgical procedures that interrupt this anabolic stage. We should be patient until anabolic stage creates the proper bone in that area, and then later on we refer the patient. Also, if we are doing X-ray studies of our patient, we should understand that catabolic stage is not the final stage of the cortical changes in response to the expansion. There would be anabolic stage that occurs with delay and in the long term. Unfortunately, these days we see a lot of rush on evaluating the result of by expansion by looking at the cortical bone too early. The third findings demonstrate that the alveolar bone is not a fixed structure with the fixed border that we cannot change. And this is not just the result of our experiment, the natural phenomenon also argues toward that. If you are losing a tooth in the one arch, the tooth in opposing arch continues to erupt with the cortical drifting at the crest of alveolar bone that gradually move or migrate the position of alveolar bone in the space. During the pathology, if you have a cyst or tumor that grow chronically, a static force is applied to the periosteum and you will see the expansion of alveolar bone. Alveolar bone is not fixed and can be changed in response to static forces, and therefore should be used as a target for orthodontics and craniofacial orthopedics. Another important finding of this series of studies is that we have a biological target that is not time dependent. We know that suture and condyle are more responsive during the growth phase, but cortical drifting occurs all your life. And that's why the form of the human face and the skull changes all the time. And we can use this target throughout the life of our patient. Remember, cortical bone is the main factor on defining the form of our patient. One more finding that is very important is the place that muscles attach to the periosteum. Activating these muscles, it can produce a macrotrauma on periosteum and stimulate cortical drifting. Therefore, at the placement of attachment of the muscles, you can see cortical drifting occurs and thickness of the bone appears in those areas. Especially for colleagues of us that want to use myofunctional therapy, this is a very good indirect way to take advantage of muscles activity to change the form. So far, we have been using phenomena of displacement when the hemimaxilla is moved in the space spontaneously in response to application of the force and the suture to address the transverse problem. Now we notice that by application of slow static forces, we have another biological targets that is not a spontaneous movement of the whole hemimaxilla, but a layer formation of the bone at the surface of the cortical bone, which argues perhaps in adults that we prefer to have significant amount of cortical drifting due to the limitation of sutural response. Perhaps a slow expansion is much better choice than rapid expansion. I hope you enjoyed this session of CTOR channel. If you have not subscribed to our channel, please go ahead and subscribe, and please don't forget to press the like button.